Methods to prevent blood clots. 1. Maintain regular physical activity. Sitting for long periods or being sedentary causes poor blood circulation, increasing the risk of blood clots. Physical activity helps improve circulation and reduce the risk of blood clots. Gentle exercise. Brisk walking, 30 minutes day, 5 days, week, at a speed of 5 to 6 kilometers to stimulate blood circulation. Cycling, 20-30 minutes, 3 to 4 times week, helps increase blood circulation in the legs. Yoga, poses such as legs up the wall, Viparita Karani, or bridge pose, Setu Bandhasana, help blood return to the heart. Practice 10-15 minutes day. Avoid sitting for long periods. If you work in an office or take a long flight, stand up and walk around every 1 to 2 hours. Do heel lifts, 15 to 20 times, or rotate your ankles, 10 times on each side. On-the-spot exercises. Flex and stretch your feet, bend and stretch your knees while sitting to stimulate blood circulation. Do this 2 to 3 times a day, 5 minutes each time. Benefits. Increase blood flow, reduce pressure on veins, prevent blood stasis. 2. Maintain a reasonable weight. Being overweight or obese increases pressure on veins, causing blood stasis and increasing the risk of blood clots. Control BMI. Maintain a body mass index, BMI, between 18.5 to 24.9. Calculate BMI. Weight, kg. Height, m. 2. Example. A person weighing 70 kilos and 1.65 milliliters tall has a BMI equals 70, 1.652, 25.7, slightly overweight. Diet. Eat lots of green vegetables, spinach, broccoli, fruits, oranges, blueberries, to supplement fiber and antioxidants, support circulation. Limit foods rich in saturated fat, fried foods, red meat, and refined sugar, soft drinks, candy, to avoid weight gain. Add foods rich in omega-3, salmon, chia seeds, to reduce inflammation and improve blood circulation. Lose weight if needed. If overweight, lose 5 to 10% of your weight by reducing 300 to 500 kilocal day and exercising. Consult a nutritionist for a suitable plan. 3. Drink enough water. Dehydration thickens the blood, increasing the risk of blood clots. Amount of water to drink. Drink 1.5–2.5 liters of water day, depending on weight and activity. A person weighing 70 kilos needs about 2 liters day. Add a few slices of lemon and mint leaves to enhance the flavor and provide vitamin C. Limit drinks that cause dehydration. Reduce coffee, strong tea, and alcohol because they dehydrate the body and increase blood viscosity. When to drink. Drink regularly throughout the day, especially after exercise or in hot weather. Reduce drinking after 8 o'clock p.m. to avoid nocturia. 4. Avoid smoking and limit alcohol. Smoking and alcohol abuse damage blood vessel walls, increasing the risk of blood clots. Quit smoking. Smoking constricts blood vessels, increases blood viscosity, and causes inflammation. If you smoke, consult your doctor or a smoking cessation program, such as the 1800-6606 hotline in Vietnam. Limit alcohol. Drink only in moderation. 1 drink day for women, 2 drinks day for men. Avoid excessive drinking because it can damage the liver and increase the risk of blood clots. Benefits. Reduces damage to blood vessels, improves circulation, reduces the risk of stroke and heart attack. 5. Use medical stockings. Medical stockings help gently compress veins, support blood circulation, especially in people at high risk, sitting for long periods, varicose veins, pregnant women. How to use. Choose stockings with pressure of 15 to 20 mmHg for prevention, 20 to 30 mmHg if there are symptoms of varicose veins. Consult your doctor to choose the size. Wear stockings in the morning before getting out of bed. Remove before going to bed. Priority subjects. People who work sitting, standing for long periods, take long flights, pregnant women, or have a family history of blood clots. Benefits. Reduce blood stasis in the legs. Prevent deep vein thrombosis, DVT. 6. Diet to support blood circulation. Nutrition plays an important role in preventing blood clots by reducing inflammation and improving blood circulation. Foods to eat. Vegetables rich in vitamin K, spinach, cabbage, natural blood clotting regulators. Note: if taking anticoagulants, warfarin, ask your doctor about the dosage of vitamin K. Fruits rich in flavonoids. Oranges, blueberries, red grapes help strengthen blood vessel walls. Anti-inflammatory foods. Ginger, turmeric, garlic, green tea containing curcumin, allicin help reduce the risk of vasculitis. Omega-3, salmon, mackerel, chia seeds, walnuts, 2 to 3 times a week to reduce blood viscosity. Foods to limit. Foods rich in salt, instant noodles, processed foods, because they cause water retention, increasing pressure on blood vessels. Trans fats, fried foods, cookies, because they cause inflammation and damage blood vessels. Sample diet. Breakfast, oatmeal, banana, green tea. Lunch, brown rice, salmon, green salad. Dinner, pumpkin soup, tofu with tomato sauce, and orange. 7. Control medical risk factors. Some medical conditions and conditions increase your risk of blood clots. Controlling them can help reduce your risk. Get regular checkups. Measure your blood pressure, blood sugar, and cholesterol every 6 to 12 months. Maintain blood pressure below 120/80 mmHg, fasting blood sugar below 5.6 mmol after L, and LDL cholesterol below 100 ml. Manage chronic conditions. Diabetes, high blood pressure, and atrial fibrillation increase your risk of blood clots. Follow your doctor's instructions for medication and treatment. Women who are pregnant or taking hormonal medications. Pregnancy and birth control/hormone replacement medications increase your risk of blood clots. Talk to your doctor about alternatives or wearing compression stockings. After surgery or prolonged bed rest. If you have to be hospitalized or have surgery, such as joint replacement, abdominal surgery, do light exercises, ankle rotation, leg flexion, and take anticoagulants if your doctor prescribes them. 8. Watch for warning signs. Recognizing early signs of blood clots can help prevent serious complications. Signs to watch for: swelling, pain, heat or redness in the leg, suspected deep vein thrombosis. Shortness of breath, chest pain, rapid heartbeat, suspected pulmonary embolism. Sudden headache, weakness in the limbs, difficulty speaking, suspected stroke. Action. See a doctor immediately if you have the above symptoms. Doppler ultrasound or D-dimer test can be used for diagnosis. High-risk groups. People over 60 years old with a family history of blood clots, cancer, or long-term inactivity. Important notes. Preventive measures need to be maintained for a long time to be effective. Adjust your exercise and diet according to your age, health status, underlying disease, pregnancy, and work, sitting for a long time, standing a lot. 1. Avoid taking anticoagulants on your own. Anticoagulants, aspirin, warfarin, should only be used when prescribed by a doctor, as they can cause bleeding. 2. Consult your doctor. If you are at high risk, history of blood clots, recent surgery, ask your doctor about medical socks, preventive medications, or an exercise program. 3. Monitor your living environment. Avoid exposure to dust, polluted air because it causes vasculitis. Live in a clean, airy space. Preventing blood clots is a proactive process that involves regular physical activity, maintaining a healthy weight, drinking enough water, eating a healthy diet, and controlling risk factors. Exercises such as walking, yoga, and Kegel exercises, along with avoiding prolonged sitting and quitting smoking, help improve circulation and reduce the risk of blood clots. Most importantly, listen to your body, monitor your health regularly, and consult your doctor if you notice anything unusual. Start today with small changes like standing up every hour or drinking an extra glass of water to protect your health long term.